Have you heard of Medicare Advantage? Here are 5 quick facts that you need to know about Medicare Advantage plans. Hey, I'm Randall Garcia with Medicare Pro, and today I'm happy to explain to you what many people don't know. They don't know the difference between a Medicare Advantage plan and other types of plan options. And so today I'm going to give you 5 quick facts about Medicare Advantage plans, and I might give you a 6th bonus at the end. So number 1, the first thing that you need to know about Medicare Advantage is that it's also called Part C. And so it's like tomato. Part C is Medicare Advantage, and Medicare Advantage is Part C. And what Part C does is it combines Medicare Part A, hospital, Part B, medical, and many times Part D, prescription drug coverage. And so if you enroll into a Medicare Advantage Part C plans, it kind of grabs everything and puts them all into one policy so that you basically will have A, B, C, and D all administered through one health insurance carrier that you select. So that's number 1, is that Medicare Advantage is Part C. Number two is that Medicare Advantage plans are network-based plans. So you can think of maybe the 2 main groups are HMO networks and PPO networks. HMO network stands for Health Maintenance Organization. And these are the types of plans that are known where you need to get referrals from your primary care doctor so that you can see a specialist. Some people think of these plans as a little bit restrictive because they need to get referrals from that primary care doctor to see a specialist. But some people will choose HMO plans because in most cases, those types of plans, maybe they might offer lower copays and more extra benefits, which we'll touch on in just a few minutes. So on top of the HMO, there's another option in network-based plans. It's the PPO network, which stands for Preferred Provider Organization. And so preferred provider organizations, PPOs, they're known for the simple fact that you do not need referrals to go from your primary care doctor to specialist. You can just go to your specialist without consulting with your primary care doctor. The trade-off is, if you're comparing HMO and PPO, is that PPO oftentimes has copays that are a little bit higher than the HMO. So I always ask this question is, what do you value? If you value benefits and low copays, then you may want to look at an HMO. If you value flexibility and freedom to kind of go wherever you need to go for your medical care, well, you're going to pay a little bit more, but you're going to have that flexibility. So number 1 in Medicare Advantage is that it's Part C. Number 2 is that these are network-based plans. Number 3 is that these plans many times include extra benefits. And so what I mean by that is extra benefits are things like dental, vision, hearing, gym memberships, over the counter, sometimes podiatry, like that's a foot doctor. And they kind of put a lot of sweet things in Medicare Advantage plans, even in some plans, depending on what state you are in and what you qualify for. Maybe you might get even like a healthy grocery credit or debit card to use on over-the-counter items. It just really depends on where you're at, and it also depends on what you qualify for. So that's number 3. Number 3 is that these Medicare Advantage plans have extra benefits. Number 4, the big thing you do need to know about Medicare Advantage plans is that they do advertise many times that they have 0 monthly premiums. And so whether it's an HMO or PPO, there's many areas where they're advertising 0 premium. And a lot of people think, wow, I'm going to get my insurance for free. And the reality is, well, it's not free. It's a 0 premium, but you still need to pay your Medicare Part B premium. And so in 2025, that Medicare Part B premium is $185 per month, but that number can go up or down based on your income. And so it's important for you to understand that when they're advertising a zero premium, you still have to pay whatever the Medicare Part B premium is for that year. Finally, number 5, Medicare Advantage plans have an annual out-of-pocket maximum. And so this annual out-of-pocket maximum is your financial safety net. These Medicare Advantage plans promise to protect you in catastrophic situations. So if something happens, cancer or dialysis, if something serious happens and you think maybe, maybe one day if I don't get the right insurance, I'm going to rack up $50,000, $100,000 of medical bills. Well, the good news is pretty much all Medicare Advantage in the United States, they have annual out-of-pocket maximums that should be less than $10,000, and in most cases lower than $6,000 or even $4,000, depending on the coverage that you end up going with. So we can get that annual out-of-pocket maximum as low as possible, so that way you're not being exposed to high risk and high accumulating medical bills in a catastrophic event. So it's important for you to understand that number 5, there is a financial protection built in. It's called an annual out-of-pocket maximum. But here you go. I'm going to give you a bonus. A bonus for today is another thing about Medicare Advantage is that these plans must cover everything that original Medicare covers. So I hear it a lot. Oh, my Medicare Advantage plan, they're not going to cover this. They're not going to cover that. I'm going to stick with regular Medicare. And hey, by all means, if you want to do that, that is your choice. But I want you to know that that Medicare, CMS, the government, oversees Medicare Advantage plans. And these Medicare Advantage plans must cover what Medicare does, and they cannot have any gaps in coverage by law. So by law, these Medicare Advantage plans cannot exist if they have gaps in coverage that don't at least match the Medicare standards. So it is important for you to understand what Medicare Advantage is, how it operates, and then you can weigh if it's right for you. I have another video that's going to go over Medicare Supplement. So if you're interested in learning about Medicare Supplement, which is also called Medigap, stay tuned for the next video, and we're going to cover what a Medicare Supplement is and how it differs from Medicare Advantage. I hope this information is helpful to you, and if you want any information, go to www.medicarepro.online, and we'd love to help you with your Medicare plan selection.